We have studied Marfan syndrome. Marfan syndrome is a genetic disorder that affects the body's connective tissue. The connective tissue holds all the body's cells, organs, and tissues together. It also plays an important role in helping the body grow and develop correctly.
Marfan's disease is caused by a defect in the gene that controls fibrillin-1. It causes an overproduction of a protein called transforming growth factor beta. This causes the various signs and symptoms.
The easy to see signs of Marfan syndrome is elongated limbs, such as your fingers and your legs. They are normally tall and thin and have a curved spine to one side, known as scoliosis. The chest sinks in or can stick out. They have very flexible joints and flat feet. Their teeth are often crowded and they have irregular stretch marks that are not related to weight gain or loss. Can also cause heart issues such as problems within the aorta. The aorta can stretch and become weak. You then can hear a murmur within the heart with a stethoscope. Also, sudden lung collapse could occur at any time. This can be caused due to air buildup or gas buildup. A curved chest or a chest that sticks out could also lead to early emphysema. Both of those are signs of Marfan syndrome. Emphysema is the blockage of airflow and can make it difficult to breathe. Eye issues include early nearsightedness, early glaucoma and cataracts, detached retina, and a dislocated lens. A dislocated lens is often the first sign of Marfan syndrome.
Diagnostic tests that are required for Marfan syndrome is an electrocardiogram, which is EKG. This test checks your heart rate and heart rhythm. An eye examination, including a slit lamp evaluation to see if the lenses in your eyes are out of place. It is important that the doctor fully dilates pupils. Other tests such as a computerized tomography, CT scan, or magnetic resonance or imaging MRI of the lower back. These tests can help your doctor to see if you have a back problem. That is a very common problem with Marfan syndrome called dural ectasia, which is the swelling of a sac around the spinal column.
The dura, which surrounds both the brain and spinal cord, becomes weak and stretches as patients with Marfan syndrome age. This then begins to weigh on the vertebrae in the lower spine and could wear away the bone. This is called dural ectasia. This could lead to pain in the abdomen or lower back. Pain, numbness, and weakness could also occur in the legs.
Although there is no cure for Marfan's disease, there are treatments to help the patient live a long, healthy life. Treatments include beta blockers and Larsons. Those are two heart medications to help with the aorta. Some surgeries, which are only needed if absolutely necessary, include aortic repair, breast bone correction, eye surgeries, and sclerosis treatment.
When a patient has a sunken or funnel-shaped chest, they will use a breastbone correction, which is when they correct the pectus effectum. They take the deformed cartilage and remove it, and leave the rib lining in place. This would allow for the cartilage to grow back normally. Sometimes the doctors will leave in metal struts. These metal struts will help maintain a form. Also, they will take the struts out between 6 to 12 months. Eye surgeries would include cataract surgeries and glaucoma surgeries if needed. When they do aortic repair on the heart, they do it to remove an aneurysm. Sclerosis treatment is used to help realign the spine from a curved back if they have sclerosis. A medication that is often used is a beta blocker. A beta blocker is used to lower abnormally high heart rhythms and for glaucoma if necessary. Sometimes it is used to reduce high blood pressure.
In the past, people with Marfan's disease rarely lived past 40. With regular monitoring and modern treatment, most people can now expect to live a more normal lifespan.
Throughout the journey of Marfan syndrome, many people with it will come in contact with doctors, nurses, pharmacists to help. Pharmacists will give them the medicine that they need, and surgeons only in severe cases.
A pedigree chart is used to track the presence or absence of a given trait, known as a phenotype, through 2 or more generations of a family.
So we're excited.
I had people looking at me from all sorts of angles. Since I was pretty small, so I'm pretty used to, being in the spotlight a lot. They diagnosed me with Marfan syndrome.
When you were younger, did you change in your size or your length from other children?
It was very long, very, very long and thin, which was always, I was always a curiosity for people. I was a very thin person, and I might have been like the length of other people, but it just made me look thinner because of the way my bone structure is.
Are your joints particularly flexible?
Yes, very flexible. That's always been a fascination of a lot of doctors.
Yeah? How far back can you go?
This is pretty much as far as I can go.
Any other fingers?
Uh,
How about your wrist?
I was pretty small, about between 6 and 7. My regular physician, she noticed a little murmur in my heart, and I went to a heart specialist. And from there, I went to specialist after specialist, to heart, limbs. I've seen a number of specialists. I've always been looked at all the time. I guess I'm really used to that. I've just been being in the spotlight and just being asked questions about my hands and my bone structure and stuff.